first of all, I want to thank the panelists first for residency is always a busy time of the year. And so for taking the time out of your busy schedules to talk with all of us working our way to hopefully be somewhere near where you guys are we're all really grateful for that. And then thank you everyone for attending. It's a good learning opportunity for everyone. And so first of all, we'd like to introduce all our panelists, and then we'll have them talk one at a time, their experiences to start off, and then we could go to a Q&A type format. So first of all, I'd like to introduce Dr. Agarwal-Harding. He's a fifth-year orthopedic surgery resident at the Harvard Combined Orthopaedic Residency Program. He's a former postdoctoral research fellow at the Orthopedic and Arthritis Center for Outcomes Research, Brigham and Women's Health Hospital, and a global surgery research associate at the program in global surgery and social change, Harvard Medical School. He grew up in Ghana, India, the United States. His clinical interests are in trauma and upper extremity surgery. His research interests are in the delivery of affordable and high quality orthopedic trauma care in low resource setting. He leads the Harvard Global Orthopedics Collaborative, a group of orthopedic surgeons and trainees with a shared interest in sustainably improving orthopedic care delivery for poor and marginalized people. For the last 3 years, he's worked on projects in Malawi to examine and improve the National Musculoskeletal Trauma Care System. He received his BS at Stanford University in Biomechanical Engineering, MD from Harvard, and his M.P.H from Harvard T.H. Chan School of Public Health. So we're very grateful that Kiran's here today. And next we can talk about Myles. He's PGY1, and he obtained his Myles Dr. Dworkin here. He's attained his MD/MPH from Thomas Jefferson University and is currently an orthopedic intern at Brown University. He's been working in low and middle income countries since 2010, where he focuses on understanding barriers to care and improving access to pre-hospital services.
And I now have the opportunity to introduce Dr. Ali. So Dr. Ali spent a year conducting orthopedic research in Tanzania after his third year of medical school. Through a Doris Duke grant at the Institute for Global Orthopedics and Traumatology at UCSF, his primary project was setting up a randomized control trial of local antibiotics after open tibia fractures. He plans to remain involved with global orthopedics going forward, including during his residency research year. And then finally, Dr. Challa. So Dr. Challa grew up in Hyderabad, India, and moved to Nevada in high school. So she became interested in orthopedic trauma while working in the ER as a college student, and started working in a home physiology lab at UCSD to study acute compartment syndrome. When she got the opportunity to combine her goals for global health and orthopedics through a research year at the Institute for Global Orthopedics and Traumatology, she took time off between third and fourth years of medical school to pursue a career that has been a monumental milestone in finding what she wants to do with her career in orthopedics. So she hopes to continue research in LMICs as an academic orthopedic surgeon in the future.
So thank you everyone for being here. So to start it off, we're going to have each person one by one talk about their global surgery experience in medical school and what their involvement looks like now that they're a resident, and just any sort of specific research they're working on or partnerships, just sort of a free time for each of you. And we can start in the same order. So Dr. Agarwal-Harding, you can start us off.
Thank you, guys. That was a very nice introduction. Appreciate it. And thank you for putting on this panel. It's very nice to do this. I think just before I begin, I think it's amazing to see how far global surgery has come, to be honest. When I was a medical student, I feel like this sort of thing certainly never existed, and perhaps wasn't on people's mind the way it is today. So really appreciate you guys organizing this. It would have meant the world to me back when I was a medical student. To have this kind of community and this kind of support. So thank you guys. So to answer your question, when I was in medical school, I came into medical school knowing pretty seriously that I wanted to pursue global health. I grew up, in tow with my parents who did international development work in education. And around the dinner table when we first moved to America, when I was, conscious enough to understand what the dinner table conversation was, it was all about education and health. These were the big topics that we would talk about all the time. So health was always on my mind as more of the sciencey person in my family. And so when I went to medical school, I knew I wanted to do global health. And the process of deciding how to differentiate as a doctor was very much tied to figuring out how best I could make an impact in the world of global health as well. access to care for the poor and underserved. So I also did a Doris Duke Fellowship during between my third and my fourth year, and did a year of just research with a program for global surgery. And that was my first real exploration of global surgery. I've done like a few little things here and there before that, but that was my first experience in doing global surgery. And I went to Haiti. This is back in 2012. I went with a team of orthopedic surgeons, and we were mainly doing like education and capacity building stuff, but a little bit of what we did was operative. And as a young, enthusiastic medical student, I think the exposure is what convinced me to do orthopedics. So in residency, I took 2 years out from my clinical training between my third and my fourth year of residency to do a research fellowship. And that was the clinical fellowship that you just mentioned in my introduction. That was really an amazing opportunity. I spent most of that time jumping back and forth from the School of Public Health here at Harvard and Malawi, where I started building a few research projects with my collaborators there. I was introduced to those folks by the UCSF team, the Institute for Global Orthopedics and Traumatology. We have 2 former fellows here. They're really a powerhouse when it comes to global orthopedics. And they introduced me to some of the faculty that they were working with in Malawi. I went there for the first time ever at the beginning of my fellowship, and sort of pitched a few ideas, and some stuck and some didn't. And I tried to read as much as I could before I went. But I learned a lot from being there. And my project sort of grew and expanded from there. Now back in my clinical rotations again, I'm now in my 5th year of residency, so I've been back for over a year now in my clinical training. I lead a group of mainly at this point like medical students and a few junior residents who are interested in global orthopedics and interested in some of the projects that we've put together. But really the purpose of the Harvard Global Orthopedics Collaborative is to pull together the faculty members as well from all of our different hospitals. We have a lot of different projects going on. A group that goes to Haiti quite regularly, the same group that I went with when I was in medical school, a group that goes to Colombia, a group that used to go to Dominican Republic. But all these different groups didn't really communicate. And I think that one of the most important things with global health in general, and global orthopedics certainly, is to have communication. Have people talking to one another, sharing ideas. Transparency is super important. Collaboration is super, super important. And so that, I think, is the real purpose of our group, is to just have that kind of crosstalk, that sharing of ideas every month. And now, as we've sort of started to expand, like Myles, I consider him absolutely like a core member of HGOC. He's over at Brown. That is, I think, the perfect example of like what we should be doing, is like having just a wide network of people who are involved in a lot of different things. So yeah, anyway, sorry, I was a little long-winded, but basically now as a resident in the age of COVID, it's very difficult for me to get to Malawi, get to any of these different places. But from my research work in Malawi, those projects have expanded, and now we're starting to get involved in other countries. I've got a project going on right now in Cameroon. I've got some colleagues who are designing some stuff in Ethiopia. And all of these different projects are sort of tailored by the local collaborators to the environment there, but incorporate some of the same themes and lessons learned that we learn from many low resource settings, where the challenges are so complex, but they sort of like, they're not the same, but they rhyme, kind of thing, But yeah, so now I'm trying to do whatever research I can remotely, trying to support my colleagues however I can. I get x-rays and stuff from colleagues in Malawi all the time that I'll pass along to some of the colleagues here, some of the attendings here that I work with at Harvard. And I think creating that kind of link, that's a huge role that we can all play, is creating that kind of link and advocating for the folks in these different settings. So yeah, I'll stop there, but thank you guys.
That was awesome. Thank you. It seems like you've done so much for the global surgery community, and especially the global surgery orthopedic community. And it's going to be hard to follow up that great of an introduction, Dr. Dworkin, but you can give it your best try.
I won't even try to compare myself to Kiran. Kiran's a legend. Hey guys, it's great to be here. Thanks for having me. Thanks for that introduction. My name is Myles. I'm from Philadelphia. Went to Jeff for medical school. I started getting involved in global health about 10 years ago. I took a year off after high school. I worked for a nonprofit in Ghana doing mostly educational and public health work. then throughout college, I've stayed involved by going over during my breaks, doing some administrative stuff during my time, throughout college. When I got to Jeff, I started working in Rwanda, primarily clinically at first. I engaged in some orthopedic rotations at the University of Rwanda the summer after my first year and the summer after my third year. Then I took a year off between my third and fourth year to get an M.P.H. and was able to spend majority of that time in Rwanda conducting research. Primarily my research work in Rwanda has been focused on improving access to pre-hospital care, as well as studying different delays and surgical barriers, both orthopedic, general, and just kind of working with the orthopedic residents at the University of Rwanda. It's a little early for me to say, what my involvement in global surgery looks like as a resident, as I'm only 4 months in. But I've tried to stay very involved with a lot of my colleagues over at the University of Rwanda. The orthopedic residency there is still relatively new. They actually just graduated their first class, I believe, a year ago. And as part of their requirement, they do have to do a thesis and a big thesis defense. So I've tried to provide them with as much support as I can, throughout that process, trying to help get their work disseminated through publications, finding them grant funding for conferences, that kind of stuff. So in terms of, continued resident involvement, I see kind of that being a big component of what I'm going to be doing in global health. And then kind of just keeping up collaborations that I've already established. Like Kiran said, I'm very grateful for him to allow me to stay active with, HEOC up there, and then some colleagues I've made at Utah and VCU and kind of all over the place. Global health, I think historically one of the big issues has been everybody working in silos, everybody working independently, nobody communicating, nobody talking. And so one of my big things is trying to communicate and get as many people involved and talking as possible. So I'm also the resident representative for the GSSA, and I think that's been great. Being able to work, with Josh and Mike here and, the rest of the GSSA team, talking with medical students, getting them more involved. I feel like that's very important.
Well, thank you so much. And continue on to Dr. Ali.
Hey guys, thanks for setting this up. My name is Syed. Two very accomplished people before me. Just briefly about myself, I'm an intern over at UCSF. I did a Doris Duke fellowship like Kiran between my third and fourth year. I grew up abroad. I was born in India, lived there for a while, lived in Europe for a while. So always have been interested in global health when we moved to the States. My parents also worked in that field and did a lot of epidemiologic research throughout college. So it's something that interested me. And then in medical school, I was part of the global health pathway. So, that was something I kind of tried to stay involved in. But orthopedics is traditionally a field, like Kiran said, that hasn't really had tons of opportunities for involvement in global health. So I always wanted to kind of find a way to make that something, part of my career, but struggled to do it. And I was lucky to find a former student who had done the UCSF IGOT program and had kind of worked with them and showed that it was possible. So, based on that, I reached out, and obviously it worked out. So I spent a year, close to a year in Tanzania, working on a few different projects, the main project being that trial, and have tried to stay involved. Going forward, obviously, like Myles said, it's hard to say right now what our involvement will be like, but I get a year in between my third and fourth year of residency to pursue whatever type of research I want. Most likely that will be with the Institute for Global Orthopedics. So I'd like to stay involved in that front. And I think in terms of what we can do, there's three real avenues that, we can engage with global orthopedic surgeons. I think there's education, like training. I think there's research. And I think there's just improving, the trauma capacity itself. And I think as residents, it's the easiest to get involved with the research and possibly the education and cross-pollination aspects. So I think during residency, those will be the two that we'll try to focus on.
Thank you. Yeah, there'll be plenty of time, and residency's a long time. There'll be plenty of time to get involved. So Dr. Challa, you can go next on the question.
Okay. I hope everyone can hear me. My internet's being a little spotty tonight. But I'm Sravya. I'm one of the PGY2s at H-Core here in Boston with Kiran. I also grew up in India like Syed, and didn't quite realize if or how I wanted to do global health until just before med school, when I spent a few months in India doing some clinical work in the ED and just saw how different trauma was approached there versus even one of the leading hospitals there, versus when I worked in college in an ED here. And that sort of set in motion my interest in trauma capacity building and orthopedic trauma. And then ortho trauma has always been what I wanted to do. I knew that going into med school. And somehow locked into the UCSF, I got family between my 3rd and 4th year of med school, kind of like Syed did. It's just a wonderful umbrella to fall under, both mentorship wise and just being able to see just what the scope of global orthopedics means, because I think there's a lot of opportunity out there to go sort of do cowboy surgery and leave behind a trail of people lost to follow up and botched surgery and just surgery without principles, essentially, and taking care of vulnerable, taking advantage essentially of vulnerable populations, and seeing that you can take a step back from that and focus on education and capacity building is the reason I call that year so monumental in my development as a budding global orthopedic surgeon. In terms of residency, I will say to both Myles and Syed, it is difficult to do the work that you could do before residency as an intern, but towards the end of intern year, I kept finishing up projects that I'd started back in med school. And now I'm continuing to work with the same mentors and developing projects that I will hopefully be carrying on when and if I get to take a year off between also 3rd and 4th year. Here at H-Core, there's no structured year off for research, but you can take time off being funded through a grant to either do what Kiran did and take 2 years off, or take 1 year off to do both research and clinical work abroad. So that's what I'm hoping to do.
Great. Well, thank you so much for all those introductions. That's really exciting to hear your background. And I think, at least from a student's perspective, it gives me motivation to keep going through this route, because there's definitely opportunities. And that kind of stems to our first question. And we've kind of talked about it a little bit, but we kind of wanted your perspective on how to incorporate global surgery into residency. What avenues that you've seen. Do most people do like a short-term project or a long-term, or do like a program like masters or fellowships? Or like, what does your specific research time look like in your program or programs that you've seen?
So I think for orthopedics, it's a little different than some of the other fields. Like a lot of gen surg programs have a little more established global surgery pathways, whether it's a year off or 2 years off, or a master's in public health or global health kind of incorporated and funded. So it's a little unique. I mean, it's a little unique to each program, exactly how they provide global surgery opportunities. Almost every residency program does offer some form of dedicated research time. Whether it's, 6 weeks as a 3, or, the way we do it at Brown, we have 2 months as a 4 or 5, and then we do a dedicated PGY6 trauma fellowship that also has some longitudinal research involved. So it kind of is a little bit more dependent on the individual program, but I would say that it mostly comes in the form of dedicated research time, or, I know UCSF and Harvard, there are opportunities to take more kind of extended time away from clinical practice to do it.
Yeah, I think like Myles said, there's a lot of variation and heterogeneity between orthopedic programs, but the way it's done here at UCSF is you get dedicated research time, like Myles said, every year. And in addition, every year UCSF holds kind of surgical skills courses where they host the surgeons from low and middle income countries, and you can interact with them. You can build, relationships and come up with ideas. And it's nice because as a resident, your time is very limited, so you can't really, get something going from the ground. It's very hard to get something going from the ground up. Whereas if you build those relationships, you can, stay involved and provide guidance and kind of do every single thing because there's other people involved. So I think, just kind of finding those other people interested and finding ways to stay involved. Varies between programs, but I think if you find the right program, it can definitely be done.
Thank you for those responses. We can go to the next question about, so we can answer each of these, unless someone else, Kiran, do you have any thoughts on that?
Sure, yeah. It's just to speak to a little bit about like the experience at Harvard, since it was mentioned by Myles. Like, I agree with the comments made by the three other folks. Like, it's very difficult in junior residency, honestly, to continue doing global orthopedic stuff, except, if you're a rock star like Sravya and still writing papers that you started when you were in med school, or like Myles, actually. Myles just finished a manuscript. It's really amazing. I don't know if I would have had the time to do that when I was an intern. I think any leftover time I had was spent, doing laundry and doing dishes. But like for me, that's why taking 2 years off was like never really a question. I knew that I wanted to really dedicate time, and I was lucky enough to be in a program that allowed that. I know that UCSF allows that. Heather Roberts, for example, took a year off and got an M.P.H, I think, during that time, and did some research with IGOT. So the models are, I think, starting to develop, at least in UCSF and Harvard. Every program, not every program, but many programs will have some kind of elective time in the senior years of residency. And that's a time that if you have the initiative, I think you can start to create opportunities for yourself, whether it's purely clinical or a little bit of research, to go and actually experience what it's like to be in these different settings. There's a lot of growing up you do as a doctor in residency, obviously, and what you can do as a medical student is very, very different from what you can do as a resident, and that can sort of make or break your career. I've seen it happen with a lot of folks. Like, they will come in super enthusiastic. I want to do global health. It's what I really love. And then, things change, priorities change. And I think doing that in residency, again, like having another experience will really help figure out, what the future will be for you. But yeah, every program, will usually have some sort of elective time that you can make work. Other than that, that certainly exists at Harvard. And like people who don't take 2 years out like me, will do that. We'll do like a 1 month or 2 month kind of elective in a different country or different setting. And the other opportunities that exist are sort of like 1 week kind of trips, the sort of mission trip model. Like the team that goes to Colombia every year, they go for a week, and that's usually vacation time, right? So you can figure that out. There are people who go to Haiti, and we put on a conference there every year, and usually we would use our vacation time to go. Those experiences, while short, can actually be really impactful. You can learn a lot from being there for a short period of time, especially if you're with a group of people that have like a established relationship with the place and with the local staff. That can teach you a lot about how global health works, especially like the whole lead up to it, all the nights and weekends that you spend preparing for that kind of trip. And you'll learn what's good and you'll learn what's bad. And I think that's the value of any experience, is sort of like figuring out what works for you and what doesn't, and what works for the work that you're doing and what doesn't.
Sorry, just to make another comment before we move on. I agree with everything that Kiran said, and it's really hard to dedicate time while also trying to learn orthopedic surgery towards doing global health, especially in your junior years. One of the best pieces of advice I've gotten as a junior resident is just to not fall into this pit of should you do an M.P.H if you want to do global orthopedics. I think while it's amazing and really helpful, it's really about asking yourself, am I doing this MPH to have time to do the research that I want to do, or am I doing this MPH because I want to do an MPH? And, you know, one of the things that was mentioned initially when the question was asked is this the time to go do a degree? And Kiran had a unique experience where he could both spend time doing a degree, but then also immerse himself doing research for an additional year. And when you can't strike that balance, it's really about asking yourself, am I doing this degree for the sake of having time, or am I doing this degree because I believe that the MPH is what I want to do? And for me, going to doing IGOT or continuing research with them, or even when I take a year off, continuing to do research with or without the degree, is really a point of, I really want to be doing this research with or without that degree. So I don't know what role that would play for me, but there are people that could think the opposite way. I guess the point I'm trying to make is the MPH, you don't need the MPH structure to be able to do powerful, strong global health research. So if you have limited time, just focus it on the research, focus it on building connections, either through education or clinical work instead.
So I would disagree a little bit with that. I think that the MPH changes when you're a medical student and when you're a resident. When you're a medical student, at least at Harvard, like I think there's like a special track for clinicians compared to when you're a medical student. I don't know if that exists at other places, but at Harvard, you know, if you're trying to do an MPH as a medical student, it's like 65 credits, and it's like a solid year of full-time, you know, classwork. And then in residency or as a physician, because you're a physician, it qualifies you for sort of like testing out or qualifying out of several credits. So it's actually only 45 credits, and it's really manageable. Like a lot of attendings will do an MPH in 3 full-time summers, which is very easy. And so I did that. Like I basically did 2 full-time summers, and then I did like a little bit of part-time class work throughout the rest of my time. And honestly, I like Sravya, like I had an opportunity when I was in medical school to think about doing the MPH, and I was like, you know what, I don't really want to just get the degree for the degree's sake. I want to focus on the research, and I did, and it was a wonderful experience working with the GSSA, and it really shaped me a lot. And then when I was doing my research fellowship, part of my fellowship was they gave me the funding for the MPH, and at the same time, I was thinking the same thing that I thought back then. I was like, you know, do I really need a degree? Like I want to focus on the research. I just want to like continue to build this collaboration. That's what I really care about. I don't really need the structure. And it was my mentor who pushed me. And it was, you know, an expensive decision to go for because I still had to pay my way partly. But it was really worth it. It was really, really worth it to get that training. I learned a bunch of skills that like I kind of thought I knew already and I thought I'd mastered, but not to this level. And the portfolio of research projects that I delivered in Malawi became sort of like a blueprint for me in all of the global health work that I do. Like we did a little bit of epidemiology, we did some biostatistics, we did some qualitative research, some capacity assessment kind of stuff, you know, geospatial mapping work, and all of these different pieces that I kind of knew in the back of my head when I was a junior resident might be important. I suddenly was diving into them full time. And, you know, when you're a clinician doing the MPH, everything is focused on like, how is this going to benefit your career? They know that you're doing this to augment whatever career you're going to have when you leave. And so it becomes very tailored to the specific needs that you have. So if you come in saying, like, I need these skills and I need to develop these projects, the projects that you're going to like write up as manuscripts become the projects that you do in your class. The classes that you take are specific to the work that you're trying to do. And that may not have been the case when I was a medical student, but when I was a resident going through the MPH, I found that to be really helpful. I have benefited enormously from having done my MPH, I think. And of course, the network and all that was great, you know, and it's nice to be a student again. I don't want to go back to doing it ever again, probably, but it was nice for a little bit.
Thank you so much for all those insightful answers. Oh, sorry, Myles, I don't want to.
Do you mind if I jump in here? I think that conversation actually goes really nicely into, you know, what is the role of global health during your residency? You know, I think one of my kind of so I took a year off between 3rd and 4th year. I was always going to do it. I was trying to decide exactly what I wanted to do. I remember sitting down with one of my big, you know, global health mentors. And he told me, if you really want to make meaningful contributions abroad, you have to focus on your education at home. So whether that's, you know, getting your MPH, whether that's, you know, staying late during residency to do that extra case or see that extra patient, you know, yeah, we all love global health. We all want to be on the ground doing work, you know, getting our hands dirty. But residency is about learning how to be a clinician. And it's really hard. And yes, you have 5 years, but when you get there, that's really not that much time to go from, you know, a medical student where just like kind of hanging out with no responsibilities to, you know, being a surgeon with somebody's life in your hands. So yes, I think everybody should really, you know, I encourage everybody to get as much global health experience during residency, but also keep in the back of your mind that, you know, the primary point of, you know, being a student is gaining that education. And yes, some people do that best by getting on the ground and doing it that way. And others do it more through, you know, studying, and you kind of have to find your path and see what works best for you and sets you up to be the most, you know, competent, well-rounded surgeon you think you can be.
Thank you. And just to quickly answer a question in the chat asking what, clarifying what M.P.H means, it means Masters of Public Health. We do have a wide range of people in the audience that signed up, a few undergrad, but mostly medical students. And so thank you for all those answers. We can go to the next question, which will be a little bit more specific into like residency and how you chose that. And so what did you find most important for you guys individually when looking at residencies, and how strongly did you consider support for a global surgery when you were choosing your programs? If you have any thoughts of like places you interviewed or the places you chose and why, those would be very helpful. And this is one all of you could answer. So we can start with Dr. Challa.
Global health opportunity and essentially mentorship was probably one of the biggest things up there for me in terms of my rank list. And I think my top 4 or 5 ranks ended up all being places that had a structured global health opportunity. 2 of those being UCSF, and then the H-Core program, which I went to med school in California. I spent a year at UCSF and then some more time there as well as a 4th-year med student, and I loved it there. And then I was essentially choosing between UCSF and H-Core when it came down to it, and having multiple conversations with mentors that all boiled down to global orthopedics also means building a network of connections and expanding on that as much as you can. And I think it's hard still to choose programs in orthopedics that provide this amount of structure that both H-Core or UCSF provides. But I will say that even when there isn't a structured program, I think there's something to be said for look where your mentors end up, look where your mentors work and what sort of support they have and what kind of research they're doing, and what support they're getting from their institutions when they're doing that work. I've known of other orthopedic surgery attendings who don't fall under these umbrellas of organizations that do very successful orthopedic work, because they either have a private practice set up that their partners are really supportive of what they do and allow them to take the time off that they need to go teach elsewhere, or go spend that time, or they have the capacity to take on, you know, whoever's missing's work to be able to do that. So while it's really easy to try to find these silos of really great organizations with global health backgrounds, I think it's also important to like recognize that people in various practice settings all do global health, and lots of conversations with your mentors about that. And I think there's also the other thing that's discounted is one of the programs that I really liked was UT Austin, and a bunch of their work centers around low resource setting and underprivileged populations, but it's within America, which is still really interesting work, and it sort of has the same reach as we all want to have with research in low resource settings. The research in terms of cost effectiveness or whatever that they're trying to do with undocumented immigrants or just border policies in general is really interesting work. Similarly, in Sacramento, they're doing the same work, and there's a little bit of work similarly coming out of San Diego. So I think it's easy to fall into this impression that global health has to be in sub-Saharan Africa or South Asia, but I think we just need to expand our definitions and find mentors in different geographic locations, but also just with different ideologies about global health.
For sure. Yeah, a lot of us always like to think of global health as you said, sub-Saharan Africa, but I come from an area where there's multiple Native American reservations in the area, and those are key to having global health outreach in those areas as well. And so, uh, Dr. Ali, if you wouldn't mind going next onto Wyoming.
Yeah, absolutely. Yeah, those are great points. I think in terms of picking the residency that's right for you, that's a very personal decision. I think there's so many things that go into it. Global health being one of those, but like for orthopedics, people always say like blue collar, white collar, and what that really means is there is some trade-off for most places between operative experience and like research, academia, global health. I think there's a few programs that don't have that. I think UCSF, H Corp, Brown are probably some of those few programs. But it's a very personal decision. Like if you want to be like an academic orthopedic surgeon who's very involved in global orthopedics, doing research, doing multi-center studies, I think you'd probably want to go to one of those programs where, they're highly invested in global orthopedics like H Corp or UCSF or Brown. Some people are very interested, but, for whatever reason, it's perfectly fine. They might not want to be quite as involved. And in that case, there's tons of great programs out there that might not be quite as gung-ho, but that you can still get some global orthopedic experience, like Utah. There's a lot of great programs, basically. So I think, it's a very personal decision. It comes down to like how much you value the interplay of like operative experience, research, global health, like what field you want to go into. For me personally, I really came down to UCSF and one other program that were probably equally strong in many respects, but for me, I was interested in more of an academic global health career, so UCSF was a no-brainer. But I think, 99% of people would have been equally happy at this other place. So I just think it's very personal, and it comes down to what you value the most.
Thank you for that answer. Yeah, all this process comes down to the person making the thing. We all want guidance, but at the end of the day, it's you that have to make the right choice. So, Dr. Dworkin, if you don't mind.
Yeah, I think global orthopedics unfortunately has kind of lagged behind some of the other subspecialties in understanding of the importance of global health. So what was one of the most important things for me when going through this process is just finding programs that understood that idea. And as basic as it is, my application definitely skewed itself to more global health type of programs. And it was very clear that that was something that I was passionate about and wanted to incorporate into my long-term career plans. But I was a little bit different, I guess. I was looking for programs that didn't have quite as rigid as, or kind of not rigid, but formal global health programs. I kind of do a little bit better in more flexible settings. And I am very fortunate to come from a background where I have, a number of experiences in the field. So I wanted to be able to have the flexibility to continue those longitudinal partnerships. But once again, kind of like what I was saying before, I think really the most important thing in this process is not finding a place for you to, necessarily, develop solely as a global health provider, but as an orthopedic provider, both at home and abroad. And you have to find for yourself kind of what that balance is. Like Syed said, whether it's white versus blue versus gray type of program, whether it's programs that offer formal years off to do it, or whether it's more of a longitudinal research experience, or, whether they have 1 million attendings doing, mission trips, or if it's more just like one guy who happens to go to Ethiopia every year for 6 months. So it's kind of, once again, like Syed said, it's a very personal decision. You have to kind of find the right balance for yourself and kind of figure out, once again, what you think will set you up for success and to become, a well-rounded orthopedic surgeon.
Thank you for that answer. We can go to Dr. Agarwal-Harding next.
Yeah, I mean, I agree with everything that was said. Like for me, when I was exploring different opportunities, different residency programs, mentorship and open-mindedness were really important. Like I needed to be in a place that would not only understand, but like welcome the interest that I had in global health. For me, it really came down, like the reason that I, ranked Harvard first and really wanted to go to Harvard, despite the fact that I was like so ready to leave Boston after, coming here from California and like just being done with the winters. I decided to stay, which was a surprising decision for me, because there was no other program that allowed me to take 2 years off and do this dedicated time. The mentors I had here were not only interested when I came for my interview in the kind of work that I'd done in Haiti and in India and Ghana, but they were, they asked me the kind of questions that made it clear that they actually not only had their own experiences in these kinds of settings to help them understand what I was doing, but were sharp and inquisitive, and pushed me to sort of demonstrate that I was thoughtful about these sorts of things. And that's what I wanted. I wanted a place that was going to like really shape me and make me the kind of thoughtful and effective surgeon and researcher and collaborator in the future. And I think that's what I've gotten. Harvard has been an amazing learning experience, and the 2 years I took off were unfortunately the highlight of my residency for sure. They allowed me to do so much, and they have completely shaped my career for the future. So that was really high on my agenda. When I was going around and doing my sub-Is, I looked very seriously at UCSF. I worked even back in med school. Like back in med school, Dave Shear was a resident, and he and I, like he was just starting to work in Tanzania, and he was awesome to speak to back then. He was just starting to build that collaboration. It's amazing to see what he's done in that time. I went to Muhimbili Orthopaedic Institute like a few months, I think, before Dave ever went there, back in like 2000 and what was it, 2010 or something like that, 2010 summer. Anyway, it was wonderful to like see like what UCSF does. They have been a model for me to think about how to do effective global surgery work. And I went there for my sub-I, and I must have pissed someone off because I didn't get an interview. But that's okay. These things happen. Actually, I know exactly who I pissed off, and I know exactly the moment that I lost the interview, but that's another story. So anyway, the point is, like, all these things will affect like where you end up and the decisions you make. Like UCSF has, like we at Harvard have had obviously a close relationship with UCSF. We invited a lot of the IGOT people to come to Haiti with us the last time we were able to go in person. That was awesome. And, 2 years ago or a year ago, we used to have this thing. We have the Harvard Global Orthopedics Collaborative. We used to have the Harvard UCSF Global Orthopedics Collaborative, HUGO, we used to call ourselves. Who knows what's happened to that? Unfortunately, we've all just gotten too busy.
It's Syed's fault.
we gotta revamp it maybe. But these two programs, I think, like Harvard, because it's just so big and allows you as a resident to just really do whatever you want to do, honestly. Like if you come in and you have a really strong interest in global health and you are pushy enough to make that happen, you can do it at Harvard. And that's another thing that I was really looking for. I looked at a lot of other programs very seriously. I also didn't get an interview at Brown. They refused to interview me, but that's okay. Myles was, what they were looking for, obviously. But when I was interviewing, I interviewed at Dartmouth. And Dartmouth, like, I don't know if I would have had it on my radar really if I didn't have like an amazing interview. And two of their traumatologists had gone to Haiti a couple of times, and they don't have like a really strong partnership in Haiti, but they have the open-mindedness. And there was an opportunity to take a year off and work in the Dartmouth Institute on some like cost effectiveness stuff. And when I was a medical student, I thought to myself, like, that would be great. Like I could be surrounded by people who understand the context and understand my passion for it, and could give me kind of the skills I need to build that repertoire. And at the end of the day, if you have a little bit of support and a little bit of flexibility and the willpower, all it takes is like the connections. And you as a medical student right now can go out and like start making these connections that will carry over. Like life doesn't completely stop when you become a resident. Like Sravya is still working with UCSF, you know, Myles and I are still working on some stuff, right? So all these things can continue. Continue to build networks always. Keep talking to people. Do stuff like you're doing right now, like being on talks like this and networking. And all these networks will help you, I think, if you have a place that has that flexibility. If you go to a place that's just going to be like, we don't care about that kind of stuff. We want you to just like be in the ED handling consults. When you go home, you better be working on a paper for like the chief of whatever, right? I mean, there are places like that. And that maybe, you know, Myles kind of alluded to this, maybe that's what you want. You want to just like get beaten in like the hot fire, you know, into like the like most solid, hardest steel orthopedic surgeon ever that you can possibly be. And that's the kind of skill that you will take. But, you know, for all the people who are probably on this call, I can't see any of your faces and I don't know who you are, but I imagine the reason that you're interested in global health is because you have already found that there's something you can offer, even at this stage. And I would say if that is true for you now, that will always be true for you, and always focus on that. What can you offer? What is the thing that's most, what can you give of yourself that actually makes a difference for people? And don't just always look to the future. Like, I want to be this kind of person in order to get these kind of skills to give this kind of output. Like, start thinking about what you can do right now, right? Like, as an intern, you can mentor a student there. You can work on a research project. You can do some data analysis. You can do the background reading, right? If you have a background in data science or in engineering or in language, you can translate, you can do anything, right? There's so many skills that you can bring to the table, and each of these skills will help you gain a different skill set, a different experience, and a different aspect of your future career will be solidified, I think. But yeah, like, as you gain the clinical skills, just find ways of applying them. You know, as a junior resident, you don't really know how to fix a bone yet. You just don't. But you know how to do a closed reduction. You know how to like put out a splint. You know your basic anatomy, and you can teach that. As a senior resident, I still don't know how to do everything, but I can like walk a junior resident in Malawi or in Boston through approaching a both bone forearm fracture, or how to do a TFN, right? Like, these are things that you learn and you can move on, but it takes that drive. You got to have that drive, and you got to have a program that will support that drive. That's, I guess, my main point.
Great. We really appreciate that. That whole conversation was very helpful, at least for me. So we kind of wanted to dive a little bit deeper into this discussion about residencies and the whole process, and specifically about the interviews. We just wanted to know if you could go back, like, what other information would you have ascertained from programs when you were applying? And specifically, like with global surgery, are there any kind of supports that you would ask about or consider in the application process? Like, for example, in medical school, like, we didn't know too much about, or at least I didn't know too much about trauma centers or like transplant centers, and that sort of information would be like a major part of my decision now as a medical student. So, like, what are some of those things we should be thinking about when applying for residency?
Good question. Very good question. You know, hindsight is always so helpful, right? Like, when I think back about all the reasons that made my medical school experience so great, they were not at all the reasons that I had when I first went there, when I was an undergrad thinking about it. And same thing for residency, honestly. Like, when I was going around, I was thinking, oh, well, how many cases do they get when they're junior residents? You know, how comfortable do they feel in the operating room after their intern year? You know, these are sort of the questions that I thought to myself a lot, and they really didn't matter at all in my training. Everybody's going to be different. For me, when I look back, the most important thing for me was the experience I had on the interviews. When I sat there with a faculty member and explained what my interests were and talked about the research I was doing, was the response from them like, oh, cool. Do you know this and this person from wherever you're applying from, right? Like, if that was the response compared to like, wow, I had this experience and this is what I had, I feel weird about, this thing, what did I do right here? These were the kinds of responses that made me really like programs. And I think that mattered way more than anything. So I just went through all my fellowship applications. I just, I'm going next year to a hand fellowship. And the same thing happened. Like, I went around and had all these interviews and people asked me like, where do you want your career to go? And I spoke obviously a lot about global health, and the places where you, like I had attendings sit down and just give me a complete blank stare, like just had no idea what I was talking about, no real interest in it, just like I was speaking another language. And then I had other attendings who said, you know, I went to Botswana once and I worked in a mission hospital, and I came away feeling like I could have done more, you know, like there were these patients that are almost certainly going to have complications, and I'm not in touch with those doctors anymore, and I just feel like I didn't do the right thing necessarily. And you know, that was really meaningful to have someone, you know, and to spend a year working with someone like that who's thoughtful like that mattered a lot. So I would say those connections are going to be really important. Like I'm sure the other folks will agree with me that residency is all about these connections with people. You know, you will learn how to be a good surgeon at any orthopedic residency program, I think. And the quality of your skill as a surgeon, I think, will depend a lot more on your enthusiasm to be a good surgeon and your fortitude to keep going in residency. But like the real enjoyment and the real future possibilities will come from the connections you make. And those connections, you'll just get a taste for them during your interviews.
Wonderful, thank you. Any other thoughts?
So once again, I'm only an intern, so I can't speak to, you know, the whole residency experience and what is actually ultimately going to be most important to me. I am very happy where I am. And I know that during the process, I tried to make it very objective. You know, I made lists of pros and cons, and I had questions all written out, and I tried to compare the answers to those questions at different programs. Ultimately, it's a completely subjective thing. I kind of feel you have to go with kind of what Kiran said, you know, where do you feel is right for you? Whatever that is, you know, if it's the white collar program, if it's the blue collar program, if it's the East Coast, West Coast, if it's being close to home, being, you know, in a new city. And I know it's gonna be kind of hard for you guys doing these Zoom interviews to get a sense for that and get a sense for how the residencies interact with each other and what the culture is like at this program and how the attendings treat the residents and, you know, what kind of familiarity are they? Are they friends? They hang out outside of, you know, work, and all those things are gonna be a little difficult to do, you know, through Zoom. So I think you really have to kind of put a little extra legwork in, make sure you go out and reach out to the residents to see what their experience is like, but also talk to residents about, you know, people you trust about other programs. You know, if it's somebody you trust, they should give you some, you know, good information about kind of what their experience was like when they went to do those interviews, that you might miss in just like a virtual Zoom setting. But I think it is something that's very subjective. You got to go with kind of your gut and what feels right.
I just want to echo all of the responses to this and the prior question about how you chose a program. I know we're all interested in global health, which is why we're all on this panel or listening to us. But I will say that there are things outside of global health that you should consider when you're anchoring your choices. But if global health is one of your anchors, I found that there were very easy tells when a program was or wasn't interested. For example, I had some interviews where people would look at my CV and say, oh, well, you've done all these global health projects. And then you had this one high power real paper, which was something that I had done here on acute compartment syndrome. And they'd want to talk about that. That's a very obvious tell where they prioritize or how they feel about your global health perspective or interest. So there are programs like that that for me were an obvious deal breaker, but like everyone on the panel has been saying, global health is really important and you should want to continue doing that during residency if that's where you're headed. But it's also okay to prioritize, hey, I want to become the best, most hardworking, hardest to heal orthopedic surgeon first, and then establish my global health career. So like everyone said, it's a very personal choice where you end up going to residency, and global health can be an important part of that for everyone that's listening. But there are also lots of other factors that you should consider. Boston winters being one of them.
Weather could have a lot to do with that for sure. Thank you, Karen, for typing the answer in the chat there for that question. I know it's getting close to an hour, so if any of you do need to go, feel free to excuse yourself. No offense taken. Other than that, I'll try to wrap up with like one more final question specific to interviews to help the fourth years on right now. And so we're wondering about how a lot of teaching hospitals have global surgery centers or initiatives that span across the surgical specialties. Like I know Utah has a center for global surgery, and during these interviews you won't be there in person. How would you recommend students connect with these centers during our virtual interviews with the orthopedic programs to help try to get in on that? Because a lot of times during interviews, especially Zoom, they might not be able to get that connection they would normally.
I felt that if that connection exists between the orthopedic surgery department and whatever their counterpart, general surgery or the surgical department is, that if that connection was already there and fostered, it was very obvious when I was speaking with that program or looking into that program. It's not everywhere that that general entity is, the ortho department falls under that umbrella or works with them. A lot of times, for example, when I was the IGOT fellow, IGOT was really just a separate entity, even though there was a global surgery department at UCSF. So I don't know that there's always an organic connection there.
Yeah, that's tough. You know, like I do not envy the current situation of like having to go through these interviews on Zoom. You know, I think it's going to be really hard, and I'm so sorry for all of you guys who are going through it. That it's going to be a challenge for sure to navigate this. And I wish that I could give better advice, because it was so different when, you know, a better part of a decade ago when I was applying. But you know, at Harvard, there's one attending. And certainly when I was applying, there was just one attending who had any connection with these different departments, these different like centers for global health and global surgery. That Sravya, that was Dyer back then. You know, Dyer was the only one who had like kind of a loose affiliation with PGSSC, and loose is like, you know, I think generous. You know, it was hard to see the connections, and so I would say cold email people. You know, like just start reaching out. If you see a project that you find interesting, get out there and send them an email. And you know, the GSSA like database is great. Like a lot of medical students have found me through that, which I've really appreciated. And there are a lot of amazing people on there doing some really amazing work. So I would say just cold email people. It's if you do global health, it's always nice to make new connections and to hear about a student who's interested in something, and like a 15-minute phone call to connect you and just like know what's going on and connect you to other people and tell you about stuff that's perhaps not posted on websites is so helpful. So yeah, I mean, it really does take initiative. And honestly, that's what a lot of these programs are looking for, is the initiative. Like if you're gonna make it work for yourself in the world of global health, in orthopedics in particular, I would say, the pathways are not there the way that they are in places like general surgery or medicine or certainly infectious diseases, right? Like for a specialty that produces so much capital for a hospital, to not be able to invest in things like this is something that we need to change. We collectively as a group need to change. And the fact that that doesn't exist just means that it's harder for all of us right now to really make it work. So I would say reach out as much as you can and try to make those connections that you can.
Yeah, definitely feel free to cold email places. I did that for a couple of programs. And it was a great conversation. It led to some good meetings. And it allowed me to go in. So a lot of these centers are not necessarily run by the orthopedic departments. Typically they're either general surgery or OBGYN or anesthesia kind of led. But if you go and you kind of make those connections, you got to get a sense for what your involvement in global health might look like if you go to this program, if they're willing to collaborate with the orthopedic surgeons. And then when you go to your interview, you can discuss some of these things. And it just shows an initiative and a maturity and, you know, a dedication to the field. If you can go to these interviews and say, hey, you know, I met with Dr. XYZ. He's working on this. You know, this aligns with my interest here. If I come here, I can continue my global orthopedic work by doing this and this. So it kind of just shows that you're taking their program seriously. You're not afraid to go out and do the legwork. And, you know, people are very receptive to it, like Kiran said. So definitely don't be afraid of cold emailing places.
Yeah, and just to add on really quick, since we're right at the hour, if you're looking for a place to start, I think there's a website. It's hosted on the UCSF website, but it's really a shared website. It's called COACT, Consortium of Orthopedic Academic Traumatologists, and it's basically designed to be a resource for medical students and residents who want to be involved in global orthopedics. It has a bunch of different like organizations like Brown, Duke, Harvard, HSS, and the projects they have ongoing in global orthopedics, and an email that can be used to reach out to whoever is organizing those projects. It may be a little out of date, but the email should be a good way to get in touch and find someone. So if you're looking at cold email, that might be a good place to start. I'll spell it out in the chat here.
Thank you so much for those answers, and thank you for that link. Connections are always, I feel like, the most important you can do. Talk about cold emails. I've sent plenty myself, and I'm always surprised how often people do respond to cold emails. I've had people where all I knew was their name, didn't know their email, but I knew like what institution they worked for and the usual like ending, and I just guessed at their email, and that worked. It works. You're always surprised how often it works. And so to wrap up, one last question that from an attendee before we have everyone go out. It's a little bit more broad, not as specific for fourth years, but it was asking about when entering medical school and throughout medical school, what can you do to set yourselves apart for applying into orthopedic fellowships? I'm sure it's going to be changing that's a long answer. Since we're all close to the hour, we can maybe do a brief response from one of you, and I'll give a brief response for mine. For me, step one, always important. MS2s right now will still have step one, but I think MS1s are the class that will have pass fail. So that will be the one interesting thing for people coming in, that step one won't be as big of a deciding factor. Research, you always have to have some sort of research to stand out and try to get as much extracurricular activities that you can. Create your own profile, if you will, when you're trying to make this, like, that makes you stand out. A lot of my stuff's been focused on how much I love global health and global surgery. Part of the reason I'm on this panel right now, like, moderate, because I love this sort of stuff. And so being able to make yourself stand out while also, of course, orthopedics being competitive, do good on your test, do research, the typical grunt work everyone has to do. But if there's other specific responses for how to get into orthopedic residencies and orthopedic, if there's any more responses.
Just real quick, I think you hit it on the nail on the head with step one, or whatever it's going to be, step two maybe for the current MS school. I think AOA tends to be a big factor for some programs. They really like AOA. And I think if you look at the survey, every year the NMRP releases surveys of program directors for each specialty and asks them on a scale of 1 to 5, how much do you value these things? And I think the number one thing they say is letters of recommendation from other orthopedic surgeons. So like, people really value hearing about you from someone they know. So, it can be hard to do this, but if you can get to know your local, institutions, orthopedic surgeons, like, get to know them longitudinally so that they can really talk about you and speak as to how you've progressed and how they think you'll do as a resident. I think that can be really huge as well.
Well, thank you so much for that response. And thank you everyone for all your time. I feel like I could always just keep on asking questions and talk forever, but I know how busy you guys are, so I don't want to keep you here forever. And so if there's not any final last thoughts, or if Mike, you want to chime in for anything.
Just thank you so much. We really appreciate it. I know personally it's been very helpful, and I'm sure all of the attendees would say the same thing.
Thanks again for organizing, guys. It was a real pleasure. Anybody on the panel, or on the the panelists and the participants, feel free to email us. I hope I speak for all of us, but certainly for me. Happy to answer questions offline as well.
Always feel free to contact GSSA. We're here to help with anyone connecting you to global surgery or global health. And so anything any attendees need, feel free to reach out to us.
All right, guys. Good night.
Have a
Night,
good
everyone.
Thank you so much.
Thanks, Josh. Thanks, guys.
Thanks,
Thank you
guys.
everyone for your time.